Okay, so today I'm going to be talking about vaccine exemptions and why they shouldn't be permitted. So according to immunizeusa.org, in 2015, vaccines saved more lives than seatbelts in the U.S. Vaccines save an estimated 42,000 lives every year in the U.S. alone, 3 times more than seatbelts and child restraints combined. Vaccinations work to protect individuals and the people around them. If not enough people are immunized, the entire community is put at risk. The elimination of exemptions to vaccinations will greatly improve the health of individuals and communities. So today I will go over the problem with vaccine exemptions, what happens as a result of it, and the steps that can be taken to make sure these issues are no longer present. The history of vaccination goes as far back as 1855, when Massachusetts became the first U.S. state to require vaccination for all school children. At that time, only the smallpox vaccine was available. After this, other states began to pass similar rules, although they were lightly enforced. So the history of vaccine exemptions began in 1898. According to the History of Vaccines from the College of Physicians of Philadelphia, the British Vaccination Act of 1898 provided a clause to allow exemptions to the mandatory smallpox vaccination. And by the end of 1898, civil officers had issued more than 200,000 vaccine exemptions. In the U.S. today, every state requires children to be vaccinated for certain diseases before school entry. Exemptions are allowed depending on state and local guidelines. So first, the problem, the exemption of vaccinations. The exemptions of vaccinations don't only put a single body at risk to catch illnesses, diseases, and other harmful factors, but it also puts everyone around the body at risk. As stated by Kristen A. Feenstra of the New York Times in 2015, vaccines work by protecting individuals, but their strength really lies in the ability to protect one's neighbors. When there are not enough people within a community who are immunized, we are all at risk. Immunizations are necessary to live safe and healthy lives. If you are immunized, you don't only save yourself, but you are also helping the unvaccinated people. There should be no exemptions toward vaccines, no matter someone's personal or religious standpoint. People who are unable to get vaccinations due to medical issues or age depend on those around them to be shielded from the illnesses. Getting vaccines isn't the only way we keep the people around us safe. We obey laws, pay taxes, get drug tested, etc. These may be things that go against what we believe and get mad at, but if we don't do what is mandatory, then things just don't work. With this said, our health is no different. The vaccine issue statement by Secular Coalition for America states 3 major points regarding eliminating vaccine exemptions. First, vaccine exemptions leave millions of children vulnerable. Excessive exemptions mean lower vaccination rates, which leave children vulnerable to deadly diseases that can be prevented. There are a record number of children dying from vaccine-preventable diseases in the 21st century, such as rotavirus, which is a virus that causes inflammation of the stomach and intestines, influenza, pertussis, etc. It is not surprising that each of the children who died from these illnesses were not vaccinated. Second, the government has an obligation to protect public health. It's the government's responsibility to push forward laws that protect the country's well-being and safety. The government does this by committing to public health, regulating food and medicine, licensing medical professionals, and most importantly, by working to kill the spread of deadly diseases through education and mandatory vaccination. Lastly, religious and philosophical exemptions must be removed. The U.S. Supreme Court has clearly stated that the right to practice one's faith doesn't go beyond the point of jeopardizing a child's health and safety. In the case of Prince versus Massachusetts, the court held that the parent's religious belief doesn't give them the right to engage in a practice that compromises a child's health or safety. A slim amount of religious groups object to vaccinations, yet parents who attempt to avoid vaccinations are abusing the religious exemption. Immunization currently prevents 2 to 3 million deaths every year. As stated by World Health Organization in 2015, immunization prevents deaths every year in all age groups from diphtheria, tetanus, whooping cough, and measles. It is one of the most successful and cost-effective public health interventions. If global vaccination treatment is improved, an additional 1.5 million deaths can be avoided. There are 3 types of exemptions: medical, personal, and religious. The National Vaccine Information Center goes over vaccine exemptions, medical, religious, and personal. All 50 states allow medical exemption to vaccination. In most states, a medical exemption must be written by a medical doctor or doctor of osteopathy. A medical exemption is very difficult to obtain because almost all medical reasons for delaying or withholding vaccines have been eliminated by the government and medical trade officials. Some states will accept a doctor's written exemptions, while other states will have public health officials review it and reject it if the health department doesn't think the exemption is justified. The Constitution right to have and exercise personal religious beliefs, whether you are Christian, Jewish, Muslim, or other faith, can be defended, but you exercise your right. But if you exercise your right, be ready to defend it. The religious exemption is intended for people who hold a sincere religious belief opposing vaccination to the extent that if the state forced vaccination, it would be an invasion to their constitutional right to exercise their beliefs. A personal belief exemption is a type of exemption for individuals who hold conscientious objections to one or more vaccines. Less than half the U.S. states allow for an exemption to vaccination based on philosophical, personal, or conscientiously held beliefs. Requirements from this exemption vary greatly from state to state. With this being said, I will now cover why vaccine exemptions beside medical reasons should be an option. Eliminating vaccine exemptions would promote healthier communities. There has been support for this action within the U.S. government, state councils, school boards, etc. Allison Wickoff of AAP News in 2016 states that a AAP policy is calling for all states to use their public health authority to eliminate non-medical exemptions from immunization requirements for school entry. While the Academy has opposed non-medical or personal belief exemptions in the past, this is the first policy statement on the issue. The Academy supports medically indicated exemptions, but says non-medical exemptions are inappropriate for individual public health and ethical reasons. To protect those who cannot be vaccinated, community or herd immunity requires at least 90% of the population to be immunized and 95% for highly contagious diseases such as measles or pertussis. Pediatric physician Kristen Feimster of the New York Times in 2015 brings us to the thought that we are fortunate to live in an era when we rarely see many vaccine-preventable diseases, and the risk of these diseases seems minimal while the perceived risk of vaccination becomes larger. However, it is also the responsibility of scientific and public health communities to support the health of patients and ensure the health of communities in which they live. In conclusion, today we cover the problem, cause, and solution associated with the elimination of vaccine exemptions. With more people choosing to not vaccinate based on personal belief, our communities are put at risk. It is sensible policy to limit these exemptions to protect our own and the public's health. So next time you think that something as simple as a flu shot isn't necessary, remember that the average number of deaths associated with the flu each year is 32,806 people. So don't be one of them and prevent what can be prevented.
All right, well, there are a few spots where we kind of swerve off into the policy realm on occasion, and that is a mild issue. The bigger argument is whether or not the vaccinations are necessary to prevent disease and whether or not the exemptions are allowing the disease to spread as the diseases to spread as a consequence. And I think that's the part of the speech that gets the least amount of development. There's good information that shows that vaccines work to prevent disease. I'm not sure there's much controversy on that. Then there's information about exemptions, and I think that there's good factual data here suggesting that those exemptions do exist. Now the question is, are the exemptions responsible for the spread of the disease? And that's it's a little hard to tell, because some of the evidence that you have on the deaths, for instance, like when you talk about the kids dying from diseases that have largely been eliminated in the schools, they're all kids who haven't been vaccinated. So are those the kids who were taking advantage of the exemptions? If that's the case, then they're not really a threat to the kids who have been vaccinated. And you said at the end that this kind of herd immunity thing is the thing that's most important. You had kind of a 90% figure that you presented that suggested that we'd have to have the vaccinations at that level. Have we dropped below that level in the schools, for instance? That seems like it would be the way to make that argument more effective, that these exemptions have in fact allowed the number to go down quite a bit. And then here's this kind of interesting inconsistency. In one place, you're arguing that the medical justifications for eliminating or for exempting people for vaccinations have largely been eliminated. And then in another spot you say, and that we need to make the kids who aren't getting these vaccinations for religious or moral reasons vaccinate to protect the kids who can't medically get vaccinated. And I'm going, well, wait a second, if we've largely eliminated the reasons for medical vaccination exemptions and kids can get vaccinated without any medical restrictions, then those kids don't exist anymore. That's not real anymore. And so the threat there is a little bit different. It's just, there's probably an explanation for it, but that was just an inconsistency that stuck out to me. I think you have a good preview at the beginning of the speech suggesting that there's going to be a structure. I had a harder time following it in the body of the speech because I didn't get any numerical signposts and the secondary claims were not always distinct. There's so much of this that is descriptive in the process that it sounds like a narrative instead of a more structured argument. And it's not that it's a bad narrative, it's probably pretty effective. It would work really well as a persuasive speech. As an argument, it has a little bit of difficulty in structuring, and I think that needs to be something that is a little bit more obvious. I know that sometimes people don't like the idea of doing that, but we're kind of working in a different context here, and we're putting together some building blocks that work a little bit differently. The historical information is good. Like I said, there's some general information about the value of vaccines that I thought was pretty solid. You're also consistent about citing sources everywhere, so I think that works effectively. It is a little over time, so some of that is probably because we're dealing with a broader spectrum of issues as a consequence. All right, thank you.